The Centers for Medicare and Medicaid Services is now announcing new details for a plan to cover drugs that slow down the disease. ABC4's Kayla Baggerly has more on what the plan means and why some say it's not enough.
Last week at the Capitol, you would have seen dozens of advocates rallying for better access to treatments for Alzheimer's disease. Although they say that this plan that CMS has detailed is a start, they say it's not the end in helping Alzheimer's patients get life-changing care. The Centers for Medicare and Medicaid Services in their plan say that if the FDA grants traditional approval, then Medicare will cover drugs that slow down the progression of Alzheimer's disease.
We're actually really excited about this, that this will allow future drugs to be considered and approved.
Another requirement is that the medications are used in settings where physician and clinical team participate in the collection of evidence about how the drugs work in the real world, also known as a registry. Former Salt Lake County Clerk Sherry Swenson was part of a rally last week asking for CMS to expand coverage of Alzheimer's treatments. She told us what these kinds of medications can mean to people like her sister Judy, who died from Alzheimer's last month.
My sister had one of the most incredible minds. She was brilliant. She had a memory like no one I've ever seen. And then she started repeating herself and forgetting simple things. And then just it declined and declined. And it was just tragic to watch that.
She says for Judy, finding out she had Alzheimer's was difficult.
When she started having these memory issues, you know, her family finally took her in to have her diagnosed. And the day that she called me, I'll never forget it, she said, "Sherry, I'm done. I have Alzheimer's. I don't want anyone diagnosed with Alzheimer's in the future to ever feel like they're done like she did."
Advocates for Alzheimer's saying this plan is a good first step, but that the requirement for a registry could create barriers. CMS saying the registry will be used to look at the health outcomes of medications and how they change over time.
Trying to find the proper doctor that is taking part in a registry could be very difficult, especially in rural areas and for individuals of diverse communities that already have communication barriers and trust barriers.
Over 30,000 Utahns are living with Alzheimer's disease today. The Alzheimer's Association of Utah says that a change like this can make a difference in lives like theirs, but there's more work to be done. Reporting from Salt Lake City, Kayla Baggerly, ABC4 News.